communication and teamwork between healthcare workers directly relates to the safety and care of patients. According to the Cairo Group in 2016, they looked over 23,000 medical malpractice lawsuits and claims where patients suffered some form of harm. Out of all of these cases, they identified over 7,000 cases where the problem was directly caused by miscommunication that was either verbal or written. If more communication training was added to all medical professional degrees requirement, less medical error would be made, yet adding more courses to an already demanding program would slow the number of new practicing professionals each year. I've done a lot of research on this topic, and I plan to do my master's research on enhancing health communications. Today we're going to note the pros of adding additional communication classes to all medical professional degrees, as well as the cons that adding more classes would bring to each program. Some people believe that adding more communication classes would be a benefit to healthcare. Medical professionals have a very limited source of communication classes. These lack of communication education may lead to many cases of potential patient harm, lack of teamwork skills, and thus putting the hospital in danger of lawsuits just due to miscommunication. According to BMJ journals in 2012, 84 cases have been studied and examined to see where communication errors have occurred in healthcare. 44 cases of reports of verbal communication, 35 reports of handover errors, 19 reports of communication errors between different staff groups, 13 reports of misunderstandings, 11 reports of communication errors between junior and senior staff members, 10 reports of hesitance in speaking up, and 8 reports of communication error during teamwork. As you can see, there's many different places where errors can be made in medical professions. And if more communication courses were instilled in these programs, better communication could be within the teamwork and the hospital as a whole, limiting errors and increasing patient safety. It is noted that communication and information exchange via telephone-related transfers between units and consoles from other specialties were particularly a weak process. So to enhance that communication, to be able to talk with other practices and other professions is extremely important. If basics and healthcare communication courses were mandatory for all healthcare professionals, less medical errors would occur, thus saving patients, medical supplies, the hospital, and the teamwork of the coworkers. On the other hand, leading to my next point, adding more classes to medical programs would make them longer and more costly. All medical professional degrees and program requirements are long and teach vital skills to ensure that all students are well prepared and qualified for their profession. According to Lane in 2020, medical degrees take 2 to 10 plus years to complete their degree. And these professionals are in high demand. Especially in today's world, you can see how important it is for healthcare workers to be ready in these times of peace and in chaos. According to Study.com in 2020, education requirements for doctors in the U.S. may vary due to their specialty, but in general, doctors complete a 4-year undergrad degree program, spend 4 more years in medical school, and then complete 3 to 7 more years of residency training before they are ever eligible for medical licensing. So adding another semester of communication courses to a medical degree would cost more money, extend the time of a program, and delay the time it takes for these healthcare professionals to be out helping those who need care. So now that you've seen both sides of adding more communication classes, or why would you add them to delay the time for professionals to ever get to the field, I have some questions that I would like to get your opinion on. Have you or someone you know had communication errors before with a medical professional? I know I have. I'm sure a lot of people can relate as well, between either you personally or maybe someone you know, getting misinformed on simple day-to-day on your personal self, or large things like surgeries or huge directional errors that are made in health programs, health services, just due to miscommunication. My next question I have is, do you think there's a difference in communication between different generations of health professionals? This one I think could go either way. I think people could agree that different generations may communicate differently. So if you had overall training that you were all going to communicate on one basis, it would help with less medical errors. But then again, if you have the training and all the education you can learn from different generations of healthcare professionals, give a very strong attribute to the profession. The next question I have is, do you think it is more important to have programs kept the same so the needs of healthcare professionals are met, thus keeping everyone safe, or do you think changing them would be a benefit? I think a lot of people would want to keep the programs the same. I think we put a lot of trust into our doctors. We see them do such amazing things for everyone in the community, so why would we ever want to change that? I can also see some people wanting to add more communication courses because it would bring a huge benefit to many attributes to the community, to the program, to the hospital in general. So there's many different ways you could look at that one as well. My next question would be, do you think adding more communication courses would be a benefit to the program or simply lengthen and add more cost to the program? It kind of ties in with my last question, but really hits hard on the doctors do so much in their schooling, so many years, so much money, so much of that people don't really understand or even think about. They just need medical help. And so to ask these professionals to even give more time and more money into their education is another big step for these professionals. But it could also really benefit them at the end and make them an even better doctor. My last question is, with the state of today's world, would you want the medical professionals that are well-informed and know how to communicate with their team, patients, and the public? Or would you want those who are ready to defend the community and have a larger team behind them, ready to work? I think this one is really important, especially during this time. I've seen many medical professionals, news people communicate about COVID and many different contradicting opinions. Here's what you should do, here's what you should do, and sometimes that information kind of collides and it's not always well informed, and it kind of confuses the public and confuses even medical staff as well. So I think if we had really well informed physicians and informed to tell the public all one thing, to have your whole team communicate on one general consensus, I think it'd be really, really beneficial to have really good communication during this time. But on the other hand, you also hear how badly that we need medical professionals. So if we had medical professionals that could have graduated, completed the requirements, and been ready to work, why would we ever want to hold them back just so they could take a few more communication courses? We would definitely want them ready to help all of us during this chaotic time especially. So as you can see, we've talked about the pros and cons of adding communication courses to medical degrees that we've discussed today. Adding communication courses to medical professional degree requirements would help keep patients safe, it would help communication errors between team members, and it would help keep the hospital safe. Yet, adding these courses delays the demand for healthcare workers and lengthens the time of the program requirements and raising the cost of schooling. I hope that you have a new perspective on this topic and can now make informed choices when you or someone you know is getting into the medical field, or if you interact with a medical professional. Thank you.